What do you do if you see an injured dog?
Well, the first thing that you do if you see a dog that you think is injured is you make sure that the area is safe. So you make sure that there is no imminent danger in the area, such as traffic or down power lines. When you approach the injured dog, you make sure that you make noise because you don't want to startle the injured dog. That could be clapping your hands, that could be going, hey, puppy, 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 as you go, and make sure that you approach so that the dog can see you, because people can get bitten if the dog doesn't see you or is startled, especially if the dog is in pain or is injured. So you walk slowly, you make noise, and you make sure the dog can see you on your approach. So that minimizes the risk of yourself getting injured or bitten by the dog, because the dog doesn't realize that you're coming to help him. And that is what you do if you spot an injured dog. The next thing that you should do once you've assessed the situation, if you see that the dog is in fact injured, is you should have a muzzle. Now, you can't really keep a muzzle for every size dog with you at all times, so a good thing to keep is a piece of nylon rope. And this nylon rope actually has a knot in the middle, and this will be a good guide for your dog if you're making a muzzle. What you would do is you would take the knot, put it under the dog's chin, and then use this one length of the rope to wrap around the dog's muzzle. Once you've made a muzzle using the rope, then you would take the other end to be able to tie it around the dog's head to secure it in place and tie it off here with a secure knot. And that is a way to make a muzzle in case you don't have one with you in your car.
Go.
I am now going to demonstrate how to put a muzzle on Maurice. Maurice, are you ready? Okay. Muzzle on. All right, Maurice, come this way. And sit. Sit. Stay. Good boy. Come here, come here. I am now going to demonstrate how to look at your dog's head. May I see your head, sir? Very good. Can you turn to the other side? Good. And I can look into his ears. May I see your ears? And the other ear. Thank you. And in the muzzle. Do you have anything in your mouth, sir? No? Very good. To check for your dog's respirations, the best thing to do is to have your dog go on his side. Good job, good job. And we just watch his breaths. And you can time that by the minute so you can see how many respirations he has per minute. Another thing that you can do is you can check his pulse by feeling with your 2 fingers under his right back leg for his femoral artery, and you can time that for how many pulses you feel per minute, and that's how you check your dog's pulse. And then the last thing is to check your dog's temperature. I have an ear thermometer here that I use to check Maurice's temperature. Are you ready? Okay, and we just stick it in here. And that is 100.2. I am now going to check Maurice's mucous membranes and his capillary refill time. Maurice? And you'll see his mucous membranes here. You just push it with your finger and then you see how quickly it changes from white back to red. And that is how you check for his capillary refill time. To transport an injured dog, you could simply take the dog and pick the dog up. Luckily, I have Maurice, who is a small dog, so he's easier to transport than larger dogs. Another way is to always keep a carrier with you. I keep a carrier here for Maurice, so in case I can't carry him like this, I can always put him into the carrier. And this is another way that he can be transported. This is how to restrain an injured dog. Again, Maurice is small, so it's a little easier to restrain him than larger dogs. You can put him in a headlock like this, making sure to keep his head forward in case he's snapping or biting. Another way to do it is to be able to scruff him like this. So if I pick him up by his scruff. And those are 2 ways to transport an injured dog. When wrapping an injured dog's limb, it's always good to have some sterile gauze and to have what I have here, which is self-adhering tape. So I'm just going to show how to wrap Maurice's foot. This could be for if he's bleeding or if he has a sprain and needs to immobilize the limb before we can get him into a vet. So we have stuck that to itself. You should be able to get a finger in so that it's not too tight, but of course it should be firm, especially if you're applying pressure in order to stop a bleed. To administer CPR to a dog, which I'm not going to demonstrate on Maurice, but I do want to show you what to look for on Maurice. To administer CPR on a dog, you should always look to make sure that the dog is not breathing, that there are no respirations, and there is no pulse. And then you do a system called check, call, care, in which first you check all those things on the dog. You check for breathing, respirations, and pulse. Then you call your nearest emergency vet to let them know that you'll be on your way. And then you administer care. The first thing to do is an ABC system called ABC, because first you check the dog's airway. You make sure that there's nothing obstructing the dog's airway that will keep you from administering CPR. The second thing that you do is you check for breathing. You check those respirations on the dog's side to see if the dog is already breathing. If not, then you would check under the right leg here for the femoral artery to see if there is a pulse. And if there is none of those things, then you administer the CPR. That would be 30 quick depressions on the dog's chest, right about here. And then 1 quick breath in which you would blow into the dog's nose, keeping the dog's mouth shut. And you would continue that until you could get the dog to help.